chronic condition is a human health condition or disease that is persistent or otherwise long-lasting in its effects or a disease that comes with time. The term chronic is usually applied when the course of the disease lasts for more than 3 months. Common chronic diseases include arthritis, asthma, cancer, COPD, diabetes and HIV/AIDS. In medicine, the opposite of chronic is acute. A chronic course is further distinguished from a recurrent course. Recurrent diseases relapse repeatedly, with periods of remission in between. The non-communicable diseases are also usually lasting medical conditions but are separated by their non-infectious causes. In contrast, some chronic diseases, such as HIV/AIDS, are caused by transmissible infections. Chronic diseases constitute a major cause of mortality, and the World Health Organization reports chronic non-communicable conditions to be by far the leading cause of mortality in the world, representing 35 million deaths in 2005 and over 60% of all deaths. Chronic illnesses cause about 70% of deaths in the U.S., and in 2002 chronic conditions were 6 of the top 10 causes of mortality in the general U.S. population. 90% of seniors have at least one chronic disease, and 77% have 2 or more chronic conditions. Types. Examples of chronic diseases and health conditions include Alzheimer's disease, Parkinson's disease and other neurodegenerative diseases, autoimmune diseases, such as ulcerative colitis, lupus erythematosus, Crohn's disease and celiac disease, blindness, cancer/neoplastic diseases not amenable to be cured, cardiovascular diseases, cerebrovascular disease, heart failure, ischemic cardiopathy, myalgic encephalomyelitis, chronic graft-versus-host disease, chronic hepatitis, cerebral palsy, chronic pain syndromes, such as post-vasectomy pain syndrome, chronic osteoarticular diseases, osteoarthritis, rheumatoid arthritis, chronic renal failure, chronic kidney disease, chronic respiratory diseases, asthma, chronic obstructive pulmonary disease, pulmonary hypertension, deafness and hearing impairment, hypertension, diabetes mellitus, endometriosis, fibromyalgia, epilepsy. Mental illness, osteoporosis, periodontal disease, sickle cell anemia and other hemoglobin disorders, Lyme disease, blood pressure, Ehlers-Danlos syndrome. Risk factors. While risks vary with age and gender, most of the common chronic diseases are caused by dietary, lifestyle and metabolic risk factors that are also responsible for the resulting mortality. Therefore, these conditions might be prevented by behavioral changes, such as quitting smoking, adopting a healthy diet, and increasing physical activity. Social determinants are important risk factors for chronic diseases. Social factors, for example, socioeconomic status, education level, and race/ethnicity, are a major cause for the disparities observed in the care of chronic disease. Lack of access and delay in receiving care result in worse outcomes for patients from minorities and underserved populations. Those barriers to medical care complicate patients' monitoring and continuity in treatment. Minorities and low-income populations are less likely to access and receive preventive services necessary to detect conditions at an early stage. In addition, overuse of antibiotic has recently been shown has been associated with chronic disease, for example, chronic liver diseases. Prevention. A growing body of evidence supports that prevention is effective in reducing the effect of chronic conditions. In particular, early detection results in less severe outcomes. Clinical preventive services include screening for the existence of the disease or predisposition to its development, counseling and immunizations against infectious agents. Despite their effectiveness, the utilization of preventive services is typically lower than for regular medical services. In contrast to their apparent cost in time and money, the benefits of preventive services are not directly perceived by patient because their effects are on the long term or might be greater for society as a whole than at the individual level. Therefore, public health programs are important in educating the public and promoting healthy lifestyles and awareness about chronic diseases. While those programs can benefit from funding at different levels, their implementation is mostly in charge of local agencies and community-based organizations, Studies have shown that public health programs are effective in reducing mortality rates associated to cardiovascular disease, diabetes and cancer, but the results are somewhat heterogeneous depending on the type of condition and the type of programs involved. For example, results from different approaches in cancer prevention and screening depended highly on the type of cancer. The rising number of patients with chronic diseases has renewed the interest in prevention and its potential role in helping control costs. A report from the Trust for America Unregistered Trademark S Health suggests that investing $10 per person annually in community-based programs of proven effectiveness and promoting healthy lifestyle could save more than $16 billion annually within 5 years. 1. Epidemiology. In the United States, nearly 1 in 2 Americans has at least one chronic medical condition, with most subjects between the ages of 18 and 64. The number is projected to increase by more than 1% per year by 2030, resulting in an estimated chronically ill population of 171 million. The most common chronic conditions are high blood pressure, arthritis, respiratory diseases like emphysema, and high cholesterol. According to research by the Centers for Disease Control and Prevention, chronic disease is also especially a concern in the elderly population in America. Chronic diseases like stroke, heart disease, and cancer were among the leading causes of death among Americans aged 65 or older in 2002, accounting for 61% of all deaths among this subset of the population. While the majority of chronic conditions are found in individuals between the ages of 18 and 64, it is estimated that at least 80% of older Americans are currently living with some form of a chronic condition, with 50% of this population having 2 or more chronic conditions. The 2 most common chronic conditions in the elderly are high blood pressure and arthritis, with diabetes, coronary heart disease, and cancer also being reported among the elder population. In examining the statistics of chronic disease among the living elderly, it is also important to make note of the statistics pertaining to fatalities as a result of chronic disease. Heart disease is the leading cause of death from chronic disease for adults older than 65, followed by cancer, stroke, diabetes, chronic lower respiratory diseases, influenza and pneumonia, and, finally, Alzheimer unregistered trademark S disease. Though the rates of chronic disease differ by race for those living with chronic illness, it is interesting to note that the statistics for leading causes of death among elderly are nearly identical across racial ethnic groups. Economic impact. Chronic diseases are a major factor in the continuous growth of medical care spending. Healthy People 2010 reported that more than 75% of the $2 trillion spent annually in U.S. medical care are due to chronic conditions. Spending are even higher in proportion for Medicare beneficiaries. Spending growth is driven in part by the greater prevalence of chronic illnesses, and the longer life expectancy of the population. Also, improvement in treatments has significantly extended the lifespans of patients with chronic diseases but results in additional costs over a long period of time. A striking success is the development of combined antiviral therapies that led to remarkable improvement in survival rates and quality of life of HIV-infected patients. In addition to direct costs in healthcare, chronic diseases are a significant burden to the economy, through limitations in daily activities, loss in productivity and loss of days of work. A particular concern is the rising rates of overweight and obesity in all segments of the U.S. population. Obesity itself is a medical condition and not a disease, but it constitutes a major risk factor for developing chronic illnesses, such as diabetes, stroke, cardiovascular disease and cancers. Obesity results in significant healthcare spending and indirect costs, as illustrated by a recent study from the Texas Comptroller reporting that obesity alone cost Texas businesses an extra $9.5 billion in 2009, including more than $4 billion for healthcare, $5 billion for lost productivity and absenteeism, and $321 million for disability. Chronic diseases and U.S. healthcare reform. The Patient Protection and Affordable Care Act includes a comprehensive plan aiming to reduce the burden of chronic diseases by investing in prevention and promotion of healthy living in communities. http www.healthcare.gov/NPHPPHC 4 broad directions are defined in the National Prevention Strategy, calling for initiatives at the community level, building healthier and safer environments in the communities, expanding preventive services of proven effectiveness and benefits, eliminating health disparities, helping individuals in making healthy choices. While public awareness and education are essential, another important part of this process is to facilitate healthy choices by making them both accessible and affordable for all. Other aspects of the healthcare reform that should help patients with chronic diseases include increasing coverage and access to medical services, expanding coverage for clinical preventive services recommended on the base of their proven health benefits, reducing health disparities, funding programs and research and data collection to document outcomes of treatment, encouraging the coordination of medical care with the development of patient-centered medical homes and accountable care organizations. See also, acute on chronic disease in China, chronic disease in Northern Ontario, chronic illness, chronic pain, course, disease management, dynamic treatment regimes, medical tattoo, multiple morbidities, natural history of disease, virtual wards, references. External links, Bone Marrow Transplantation Journal, Center for Managing Chronic Disease, University of Michigan, Medic Review theme issue on confronting chronic diseases with longer life expectancies in most countries and the globalization of Western diets and sedentarism. The main burden of disease and death from these conditions is falling on already disadvantaged developing countries and poor communities everywhere. Public Health Agency of Canada, Chronic Disease, World Health Organization, Chronic Disease and Health Promotion,